Good day, folks. Alfie Vente here with my buddy Skelly of Vente Pain Relief Clinic. We are at my household, the Vente household. Welcome to Health Tips. Today, we are going to talk about a simple technique for your breathing. Right now, as you know, we're going through this issue with COVID-19, and there's a lot of stress and a lot of anxiety kind of tied with that. And when we have stress and anxiety, it can affect your breathing. And when it affects your breathing, it can feed more into the anxiety and the stress. So the idea is that we try to break that by helping to help you with your breathing. So this is a very simple technique. It combines the breathing and also a pressure point technique that you can use for yourself. I find it's very, very helpful. I've used this on myself at the gym after a workout. It's very, very helpful. In fact, this is actually part of a sequence that I've designed to help with potential issues with breathing, posture, muscle tightness, a number of different types of issues that people commonly will encounter, general issues. So this is a technique that can be very helpful, particularly if you are maybe sitting or slouching while you're sitting and being stressed at the same time. So the idea is we're going to try to see if we can open up the rib cage, allow the breathing mechanism to work better by doing this technique. So it's like the other technique that I showed previously in the other video. That one I demonstrated a pressure point for the iliopsoas muscle, that hip flexor. This time we are going to demonstrate this pressure point to ease the tension around your rib cage. So this is what will happen. I'm going to demonstrate it on the floor. I have a mat here to demonstrate it. But first, I want to sort of give you an idea where I'm kind of poking into in terms of this pressure point. Okay, so you're going to lie on your back. Again, I'm going to demonstrate this. You're going to lie on your back, feet flat, knees bent. Right? It's better if you actually do this in a darker room, where it's nice and peaceful and quiet. You probably need a mat to lie down. Hopefully you have one. And what you're going to do is you're going to ease into it. So the idea is basically you're going to have your knees bent, back flat, lying face up, obviously. And you're going to take your fingers, and you're going to try to actually press. You're going to press where the edge of your rib cage is. I'm going to use Skelly here as a demonstration model. Excuse me. So you're going to find basically the edge of the rib cage, and you're going to try to slowly hook underneath like this. So this is on. You can easily find this on yourself. You can feel around your rib cage, and you'll find those edges there. And the idea is that you're gonna, with both hands and fingers, you're gonna actually try to get sort of like hook your fingers underneath while you're breathing. Okay, so on me, I'm feeling my the rib cage margins here. I'm gonna push towards me and then hook. So it kind of looks like this towards me and then hook. All right. So you remember, like with the iliopsoas hip flexor technique that I showed you, the pressure point, you kind of hook like this. It's kind of the same thing. You're hooking into the rib cage, right? The idea is that you're trying to access the diaphragm. Mind you, you're not going to hit the diaphragm directly. You have to go through the abdominals, a bunch of different tissues. But the idea is you're going to try to get those muscles to relax. It's a very, very good technique, I find, in combination with a bunch of other techniques to use. So again, you're gonna lie flat on your back, knees bent, feet flat on the floor, relaxed. You're gonna hook underneath like so. It's gonna be on both sides. So it's gonna look like kind of like this, right? Where you're lying on your back. Okay, so you notice that there's your sternum right here. So there's sternum right here, and you're gonna move maybe a few inches down and find that tight spot there. And what you're gonna find is that this area is gonna be very sensitive, particularly if you're a person that suffers from potential anxiety and potential breathing issues and also posture issues. So you combine that, this area is going to become very, very tight and become very, very sensitive. And it might be tender more on the right or left sides depending on like what you're doing. Maybe you're twisted a certain way, maybe you're sitting a certain way, and it'll cause like the right or left side to become tighter than the other. So I'm just going to move Skelly over so we can demonstrate. And I'm going to move the camera so that you guys have a better look-see at what I'm doing. Okay. Okay. Apologize for this. So basically, it's going to look like this. Okay, just like that same starting position with the pressure point to your hip flexor, the iliopsoas. You're gonna lie on your back. Okay, hopefully you can see me. And I got my hands here. Notice my feet are flat on the floor and my back is flat. And basically, I'm gonna take my fingers on each side here. Basically I'm gonna move down about a couple inches away from my solar plexus and move, find the edge of the rib cage, and I'm gonna hook underneath like so. Okay. And once again, this is gonna be very, very tender for a lot of people. You might wanna ease slowly into it so you don't, hurt yourself. But you're gonna slowly ease into it. And what'll happen is that as the tissues relax with this pressure point, you'll find it becomes more and more comfortable. You'll find your breathing should become better. So I'm gonna start off very lightly, in that area here that I mentioned. You hook underneath the rib cage. And what I'm gonna do is I'm gonna breathe through my nose and out through my mouth. But we're combining this with something called diaphragmatic breathing. So what you're gonna do is you're gonna breathe through your nose and try to expand your stomach first. All right, so I'm gonna have my hands located underneath my rib cage here. So that's the first phase. And breathe out through your mouth. Right, so once again, breathe through your nose, try to expand the stomach slowly, and then release through your mouth, slowly. Okay, you're gonna do that a few times. And you're gonna notice that the tenderness that you originally felt when you first started this technique will start slowly fading, and you're going to find that it's a lot easier for you to go into the area that you're doing the pressure point on, right? So that's the first phase. Breathe into your stomach, right? Through your nose and out through your mouth. The next phase of this is basically you're going to breathe into your stomach, and then out towards the outside of your rib cage. So into your rib cage. So stomach and rib cage. Okay, so again, pressure point. Breathe into your stomach, and then into the rib cage, and then slowly release with your mouth. Okay, so again. First phase is just the stomach, get comfortable with that. The next phase is stomach into the rib cage while you have the pressure points, okay? Again, stomach, rib cage. The final phase of this is basically the top of the chest, okay? So it's gonna look like this. You're gonna breathe into your stomach, into your rib cage, and then to the top of your chest. Breathe out through your mouth while you're palpating, while you're feeling that pressure point that I mentioned. Okay, so again, into your stomach, rib cage, top of the chest, breathe out through your mouth. So you're gonna repeat that. This might take a bit of time before you get it, but that's proper breathing. You're using proper breathing techniques there. So again, you're gonna have your hands in this position here, hooking into your rib cage, and you're gonna follow through the stomach, rib cage, top of the chest, breathing out through your mouth, breathing in through your nose. So you're just gonna repeat that over and over again. This might take between 15, maybe 20 minutes or so, maybe even 30 minutes for those of you that just really want to relax and chill out. Okay, so it's a very, very easy thing to do. Find yourself a room, find yourself a space, close the door, turn the lights off, follow these breathing techniques along with the pressure points. And after 15, 20 minutes, 30 minutes or so, you should find that your breathing is more comfortable. You might find that your anxiety drops a little bit more too. So this is a technique that you can use. I'm just gonna move this back up here. So this is basically a technique that you can use for yourself on a daily basis, maybe even a couple of times a day, and it'll help ease the anxiety that maybe you might be feeling, the stress you might be feeling using this technique. It's actually, for me, the pressure points, it's a game changer in that not only are you doing the diaphragmatic breathing techniques to help with the breathing, but it also eases the tension around your upper abdominals, your rib cage here, and also the diaphragm. Remember, you're not actually feeling the diaphragm, you're going through different tissues to access it indirectly. But you'll find that as time goes by, it's going to be a lot easier for you to get into the rib cage. It's going to be more relaxed and less tender. Do it over and over again. If you practice this, you'll find that you'll tend to be calmer. And again, this is part of a sequence that I've designed, and it's just a snippet. I'm going to show you more techniques as we go on. In fact, once I'm ready, I might ask a number of you to volunteer for my first class. Just sort of like as a demo. Anyways, this is Alfie Vente once again, here with my buddy Skelly. Have yourself a safe day. And again, please like, share, follow, tag us on our Facebook page. We always appreciate that. Thank you. If you got questions, feel free to email me at admin@ventepainrelief.ca, or you can just message me on Facebook. Have yourself a great day. Alfie Vente here once again. Take care.